This morning we're going to go through mediating the impact of stress and increased well-being. Puneeta, you guys, let's start. So we have mediating the impact and stress of increasing well-being in chronic conditions like PBC. So we have Dr. Puneeta Tandon, the professor of medicine, director of the Cirrhosis Care Clinic and transplant hepatologist. And we have Emily Johnson as well, PhD student at University of Alberta. So we thank you both for being here and look forward to the presentation.
Thank you, everybody. Can you hear me okay? Yeah, awesome. So thank you, everyone, for the invitation. We're really excited to be here. Let me just see if I can click. Yeah. So my name is Puneeta Tandon. I'm, as mentioned, a transplant hepatologist at the University of Alberta in Edmonton, in Canada. And this is Emily Johnson, who is a PhD student and a future med student. So she's going into medical school in September. And we're really hopeful to keep her in the chronic liver disease space and researching in PBC. So we're going to tag team this presentation. This is my disclosures. All of my funding is paid to my institution at the University of Alberta for my research. And over the next little while, we are going to introduce the related concepts of well-being, chronic disease distress, anxiety and depression, and acute and chronic stress. We're going to then spend some time discussing science-based interventions to manage these symptoms as an important part of a whole person approach to PBC care. And we're going to discuss how you can get involved with our ongoing study called Empower, which you'll hear about during the presentation. So I'm going to start with my take-home messages. And there's two big ones that I want you to take home and just remember as we're going through this. One is that stress is common. And stress causes what we call a physiologic response in our bodies. So inside our bodies, it causes changes. And this, when it happens multiple times, can cause significant wear and tear on the body and the brain. That's chronic stress. Okay, take home number one. Take home number two is that there are things that you can do about this. And so there are science-based strategies that you can use to not only change your reaction to an acutely stressful response, but also work on all of those years of accumulated chronic stress that have caused damage to your body and brain and wear and tear. Okay, so we're going to learn about those today as well. And before we start that, we thought we would do a little, for the first session of the day, why don't we get started with just a little bit of practice, if that's okay, if you guys will play with us here for a little bit. So the first thing, we're going to do 2 breathwork practices that you can use to reduce stress. And the first one's really simple. We'll start with that and then I'll explain the video. So one of the most powerful practices you can do is actually extending your exhalation. So the time that you're breathing out as compared to the time that you're breathing in. And that stimulates the vagus nerve. And one of the easiest ways to do that is a sigh. And so we do that, right? When we're stressed, we sigh. So practice with me here. We're going to pretend we're fogging up a mirror. So put your hand up. Okay, breathe in. And I want you then to breathe out like you're fogging up a mirror, like this is a mirror. Does that make sense? You're making a little constriction at the back of your throat. That's something called an ujjayi breath. All right, so we're going to do that 3 times, and you don't need to hold up your hand if you don't need to. You can just take a breath in, and then really long exhalation, as long as it's comfortable for you, but make that sound in the back. So just do it at your own pace 3 times. Breath in. Imagining on the out breath that you're just releasing all of your tension, taking a breath in and out, letting your jaw and your mind relax as you're breathing out. Let me hear those sounds. One more breath together. Breath in and breathing out. Okay, and studies have shown that your physiology actually changes before you do that breath practice and after you do the breath practice. The second one that I want to show you we can't get you up and dancing and things, so we're just going to do it in the chair. And it goes through neck movements that go along with your breath. So I'm going to talk you through 3 neck movements. One neck movement is going to start with just you moving your head up and down, okay? And when you're going up, don't go too far back, just whatever's comfortable. You can just even lift your head up and sit up straighter. The second neck movement is going to have you taking your ear down to your shoulder on either side. And then the third neck movement is going to have you rotating your head so you got your chin looking over your shoulder on either side. Okay? And you're not doing it fast. You're going to go slow and try and control your breath and just keep things smooth. So let me just guide you through this.
Neck movement practices. Powerful practice to promote relaxation. Key things to remember. We move our neck with the breath. The movement is slow and controlled. Only go to the point that it's comfortable. Let's begin. Keeping the eyes closed, head and neck and back straight. Starting to breathe out with the chin going down towards the chest, breathing in, the head moving upwards and tilting slightly backwards if that's comfortable for you. Again, not going into pain. And just continuing to breathe like this. With the breath out, we're moving our head down, chin to chest. With the breath in, we're moving our head up, either slightly tilting back or just lifting the head up to the sky. Continuing at your own pace. Closing your eyes deepens the relaxation. Let's move into our next neck movement practice, ear to shoulder. When you're breathing out, your ear is moving down to your shoulder. When you're breathing in, your head is coming back to center. Doing that on both sides. Breathing out when your ear is going down to touch your shoulder. And breathing in, bringing the head back up to center. Focusing all the while on your breath, on the slowness of the movement. Moving at your own pace. Feeling the deep sense of relaxation that this brings. Last practice, taking your chin to your shoulder, so rotating your head, looking to one side and then the other, breathing out as you move your head to the side, and breathing in as you move your head back to center. Doing this at your own pace. Slow, controlled movements. You're doing so well. Almost there. One more. Excellent work. You can open your eyes.
So that's just 3 minutes, but it can work very well to bring you into a state of relaxation if you just are calming with your breath, your body, and your mind. So we'll talk a little bit more about that as we go into the science of these practices. Now, why are we here today to talk to you? We're here to see and talk about well-being. And well-being, as you know, is based on many different elements. It's based on your physical health, your mental health, your social health, your finances, your job. Many, many things come together to play into well-being. And having a chronic condition can certainly impact the state of well-being. So we know that certain individuals have psychiatric diagnoses of anxiety and depression and are started on medications for that. And that, I would say, is the tip of the iceberg. It is more common in chronic conditions like PBC, 2 to 3 times more common than the general population. But there's a lot under the surface of that iceberg as well that's happening that doesn't necessarily need to meet criteria for anxiety and depression. It's distress around having a chronic condition. How am I going to manage my work responsibilities? How am I going to manage my family responsibilities? I don't know what's going to happen to me. You know, what about the side effects with medications, etc.? So there's lots of things that go on that cause distress just with having a chronic condition. What is it like to live with PBC? Over the last few years, we've had the chance to speak with over 100 individuals living with PBC and do in-depth interviews. You will know better than anyone what it means for you to live with PBC. But what some of our patients have told us is around fatigue, obviously being a very big symptom, and Dr. Swain's going to talk about that, about fear and uncertainty and brain fog, about PBC affecting sleep and that making fatigue worse. And then the individual in yellow here saying what it does to your mind and emotions for them was every bit as debilitating as the physical condition itself. So why do we have acute stress? So PBC is not the only thing that contributes, obviously, to our day-to-day living. There's many other life events, environmental stressors, major life events, things from childhood that maybe individuals have gone through that can contribute to this feeling of stress. And there's individual differences in how we respond to stress. So our genes actually impact how we respond to stress. Our experiences over our life impact how we respond to stress. And that results in behavioral, external responses, as well as physiologic or internal responses. And how we adapt to those responses, determines our allostatic load, or this wear and tear that stress has on the body and the brain. So allostatic load is a concept that has an impact on health, all of this chronic wear and tear. And why do we care about this? And this was summarized in the systematic review as well as many other pieces of literature. But we know that chronic stress increases blood pressure. It can increase our risk of having a heart condition or heart attack. It can make it more difficult to manage weight. It can cause anxiety and depression. It can actually increase the risk of Alzheimer's or cognitive decline as well. It can increase our risk of infections. There's cross-sectional evidence showing it increases risk of cancers. And it can increase our likelihood of participating in unhealthy behaviors, things like significant alcohol use or smoking or unhealthy eating. There's also evolving research supporting the role of stress in actually impacting our gut and our gut leakiness, called intestinal permeability. And so this results then in increases in inflammation that can have an impact again on our brain and mental health outcomes. So why do we actually have then an acute stress response? Why do we have stress if it's got so many bad things associated with it? So a short video, I hope it plays, but this is a 10-second clip of me jumping out of a plane, convinced by my husband, who's a professional skydiver. And so this, oh, there we go, is what I was looking at. And you can imagine what that would invoke in you. And absolutely, it invoked an acute stress response in me, very appropriately. That's what the acute stress response is meant for. Oh my God, I'm going to die jumping out of this plane. So it activated my sympathetic nervous system. It made my body and my brain ready to jump out of that plane. My mouth was dry, my muscles were tensing up. I was breathing fast. My heart was pumping faster. And I had a physiologic response. If you measured my blood at that time, I'm absolutely sure I would have shown increases in stress hormones, increases in adrenaline, and inflammation. Totally appropriate. The problem comes when we're skydiving multiple times a day. And that's happening more and more commonly. So when we activate that acute stress response when we're worried about a medical appointment, when we're stuck in traffic, and really commonly, I don't know if this happens for you guys, but reliving stressful moments. We can sit there and we don't even need to be anywhere. We can recreate stressful moments in our own mind and cause an acute stress response. And that's called chronic stress, and that is what we want to avoid. So another way to define chronic stress is where these emotional and physiologic reactions occur in situations where our demands exceed our ability to cope. So again, having a chronic condition like PBC on top of life in general, with all of its demands, can be very challenging. To go over the physiology once more, this is another nice publication. And essentially it's stress at the top causing, again, activation of various pathways, including activation of the hypothalamic pituitary axis, which causes release of stress hormones, as well as activating the fight and flight sympathetic nervous system, which causes release of noradrenaline and adrenaline, which can have a significant impact. We've also got brain changes that can happen, and I'm sure Dr. Swain's going to talk to us about the brain, but this is just to ground us in a few areas that are important in the stress response. So we've got the prefrontal cortex, which is the front area of your brain. It's involved in memory, complex decision-making, mood, and impulse control. It's like the chief commander, if you want to think of it that way. And it shuts down the stress response. It's like, it's okay, relax, you're fine, you're going to be okay. That's the prefrontal cortex. The hippocampus is another area that's involved in memory, mood. It also helps to shut down the stress response. The amygdala is a very helpful little guy, but he is like our sentinel. He's the guy that's saying, oh my God, there's something happening. You got to be alert. You got to be aware. And so that's responsible for fear, anxiety, and anger, and that turns on the stress response. This is a publication from Yale looking at what happens to the brain during non-stress conditions and stress conditions. So again, they're pointing out in blue and green that chief commander prefrontal cortex area. So what is that area doing? It's doing things like monitoring for errors. It's giving guidance for attention and thought. It's inhibiting inappropriate actions. It's regulating the amygdala and saying, regulate your emotions, amygdala, it's okay. But even with mild, acute, uncontrollable stress, you start to see a loss of prefrontal chief commander. Amygdala and the survival brain kind of take over. And I would invite you to think of instances where that's happened. Maybe your cell phone goes off during the middle of this thing and you're like fumbling. You can't even figure out how to actually turn your cell phone off. I've seen that happen in conferences. Or other times where you're just can't quite think clearly anymore. And so that's the loss of the prefrontal regulation. And what happens chronically is that you can actually get shrinkage in the size of the prefrontal area and increases in size of the amygdala, so with chronic stress. So to summarize where we've gone so far, stress is real. Stress causes physiologic responses in our body depending on how much we adapt. That causes an allostatic load, which is the accumulation of wear and tear on the body and the brain. Okay. How do we now start to shift this between demands and our ability to cope? And shifting that balance can be multi-component, and there's something that works for everyone. There's some key principles, so I'll just put a few here. I think a key one is getting your disease under control, right? You're going to feel better if your disease is under better control. Symptom management, we're going to hear about itch and the exciting things happening there. And so again, managing your symptoms better will help you to cope better. Directly addressing external factors that are important for you that you can control. So whatever's happening in your external life that you can get a handle on. Social support and community, that's why being here is so important. I can't say enough about the research on social support and community and the strength that that has to increase everyone's ability to cope. Disease education, which you're here for now as well. I'm going to talk to you a little bit about exercise and a little bit about nutrition, some psychology-based interventions that we've included in our program online, and then mind-body interventions as well. So we'll go through the research on some of these. And really we were inspired, and this research started now 5-6 years ago by patients coming to me and saying, listen, we need a bit more. We need a bit more support on our overall well-being. And so our first studies started in inflammatory bowel disease, and we've done randomized controlled trials there looking at the impact of these wellness interventions, and they've resulted in significant improvements in stress, reductions in anxiety and depression. And then I met Gail Wright, who is the Carol equivalent here of the Canadian PBC Society. And Gail came to me and said, I've heard about the work in IBD, you have to do this for PBC. So with Gail, then we were able to go on a journey of actually adapting our programming from inflammatory bowel disease to primary biliary cholangitis. And Emily's going to go through some of that data with you, but it started with a pilot study in PBC, led to a larger randomized controlled trial in PBC, and then led to the trial that we're doing now, which is called Empower. And thanks to Carol, we've been able to also have your group involved with this. And Empower is looking at this intervention in multiple chronic conditions, including PBC. This is a large group of us that have been involved in this kind of work, and so I'm just showing a picture to say thank you to them. And the unique way that we've approached it is really taken an approach to say, what are some of the best practices that we realize from the East and from the West, and let's put them all together on an online program that people can follow, that's fun, and that's science-based. And we've predominantly used these mind-body interventions where you can actually use your mind to help to control what's going on in your body, and you can use your body to help what's going on in your mind. So things on the East like Tai Chi, yoga, breathwork practices, meditation, things on the Western side like exercise and cognitive behavioral therapy or psychological interventions, putting this all together into a program. And this program right now is, the version is Empower, but again, mind-body wellness techniques along with psychological programming, and throwing in there as well some disease education. So you get a tip every week, depending on what your condition is, a specific tip. This particular week, it might be too small for you to read, but it's looking at the connection between diet and inflammation. And you also get some community support and a sense of community as you're on the program, that there's other people doing the program with you. So a little more delving into the mind-body wellness techniques. Movement itself is very powerful. This is the range of movement that we have in the current Empower program, because we know everyone has different abilities. So we're going from chair movement all the way to Tai Chi, which is excellent for balance and strength, and then yoga, which is at 2 levels because some people have challenges getting down to the floor. What is the evidence here? And I want to just let you remember some of the stuff that I talked about before. So there's hundreds and hundreds of studies with this. I've just taken a few, but yoga reducing stress and exhaustion levels, yoga reducing inflammation markers, Tai Chi actually looking at people who have done Tai Chi. Remember I said that the brain changes in volume and size, and that happens as you age. Our brains are shrinking. People doing Tai Chi, their brains shrink less. And then looking at things like heart rate, sorry, I keep touching my mic, heart rate variability, which is another marker of stress, and mind-body exercise is actually really being quite strong at changing that. This umbrella review I found quite interesting. So an umbrella review is where they take a lot of papers that have been something called systematically reviewed and then put all of them together. So it's a lot of data. This is almost 8,000 patients, and they said, does mind-body exercise and exercise, how do they kind of change cognitive function? I think that's very important as we're aging. And both of them worked. Actually, both exercise and mind-body exercise were beneficial in improving cognitive health, so how you think. Mind-body exercises came out on top in this particular review, which adds another layer of benefit. So that stress reduction piece, I think, is what's pushing that. Exercise, I hope maybe Mark will talk about this, but exercise is another area that we research, and it is absolutely a magic pill that you cannot bottle. We've got tons of benefits that happen centrally as well as peripherally. So centrally, you've got your heart function improves, You've got your lungs getting less stiff. You've got your vessels getting less stiff, so your blood pressure goes down. You've got improvements in your exercise capacity. You've got improvements in your brain, like changes again in cognition or your ability to think. Your muscles not only get stronger, but they get more mitochondria, so they get more of those energy factories in there, and that results in improvements in muscle health and function. You've got reductions in body fat. You've got increases in bone mineral density, which are really important in PBC, as you know. And you get reductions in liver stiffness. So I don't know how we can ever get this into a pill. I don't think it's possible, but exercise does all of these things. Exercise also can potentially help with fatigue. And this study hasn't been published yet. This is a protocol paper still, so I'm looking forward to the UK group who's doing this study looking at exercise in refractory fatigue in primary biliary cholangitis. So again, don't have any results there, but I think that it will work. And we've done a study now, this was about 10 years ago actually, looking at exercise in individuals with cirrhosis. And in that group of individuals who were 57 years old, but looked when we got them on the exercise bike like they were physiologically 80 years old, 8 weeks of exercise actually reduced how they looked physiologically by over a decade. So they felt like 67-year-olds instead of 80-year-olds, and not surprisingly, they reduced their fatigue. Okay, so very powerful interventions. Let me tell you a little bit about breath work. This is probably one of my favorite interventions because you can do it fairly quickly and it results in things very quickly. So we've got two parts of our main autonomic nervous system. One is the sympathetic nervous system, jumping out of a plane kind of nervous system. The other one is the parasympathetic nervous system, which is the rest or relax phase. And breathwork works on activating that parasympathetic resting or relaxing part of the nervous system. And so in the programs that we teach, you learn about different breathwork techniques. There's about 5 or 6 of them. You learn belly breathing, which activates the vagus nerve because you're moving your diaphragm when you're breathing deeply, and the vagus nerve goes right through the diaphragm. And then the size that we did, that breathing out longer than you're breathing in, actually also activates the vagus nerve. So something you can do in a minute. There's been multiple studies looking at breath on stress and mental health, and our group is just doing another systematic review of this now. But you can see here in these 12 studies, almost 800 patients, significant improvements in stress, anxiety, and depression. And then just one study looking at breath work actually impacting the brain as well. There's many studies looking at this, but I've just put this in here to show that it can happen even in a short period of time. So it was 15 participants. They put them into a magnet to look at the brain waves, magnetoencephalography. And doing slower breathing, even over 5 minutes, resulted in a more regularized brain work network connection across widespread brain areas. So again, very quick changes in things that we actually want to see happening in healthier brains. What about meditation? And this really points to the areas of the brain that we spoke about before. So what meditation does is there's now multiple studies that have shown that it can actually change the volume of that chief commander. So it can make the chief commander stronger. All right, so you're able to take on those stresses that are inevitable in everyone's life. And it also decreases the volume of that fear center, the little sentinel, the amygdala. It can improve focus and memory, and it can improve emotional regulation. And these changes don't take too long to happen. There's studies showing even over 8 weeks that you can get some neuroplastic changes from daily meditation. This is some really nice work out of Dr. Suzuki's group, who's in New York, showing a study looking at brief daily meditation in people who had never meditated before. And she showed that it enhanced attention, memory, mood, emotional regulation, as I've shown you. And it was 13 minutes a day, every day for 8 weeks. So again, not hours and hours a day, 13 minutes a day. Other studies showing that it enhances memory, it reorganizes your brain networks so they're healthier, it improves, again, cognition, and it can improve sleep as well. This is one study out of Calgary, actually, where Dr. Swain's from, Linda Carlson is a researcher out there, and she did this very interesting study looking at breast cancer survivors where they randomized them into a group that meditated and a group that didn't. And what she found that their telomere length was different. So telomeres are the little caps on your chromosomes, and those can be associated with longevity, so how long you're going to live as well. And they can slowly, get damaged as we age. But what she found is the group that meditated, so the yellow individuals, or the yellow boxes rather than the white boxes, you can see that those who meditated, they maintained their telomere length compared to those who didn't. So again, having really significant impact on the body itself. Okay, flipping from mind-body to psychology-based programming, this is key as well. How do we talk to ourselves? How do we give ourselves the right messaging? And these are the different weeks in the programming that we have now. So we've got weeks on values, we've got weeks on pacing, which is so important for fatigue. How do I manage my limited energy battery with the things that I really want to do? So you learn about that. You learn about managing your thoughts and managing your feelings. You learn about being kind to yourself with self-compassion. You learn about building community or building a village. Gratitude, which itself has a whole scientific literature of benefit. And I must thank Dr. Dana Lee Bagley, who we've worked with, who's our psychologist, and she's focused a lot of the intervention work on acceptance and commitment therapy, which was developed by this gentleman, Dr. Stephen Hayes, who's a psychologist. Some of his stuff on YouTube is really great. Acceptance and commitment therapy is a little bit different than cognitive behavioral therapy, but it's a third wave CBT. And instead of trying to change thoughts, what it does is it tries to teach you skills to not get caught up in your thoughts. Okay, so it doesn't say you can't have thoughts that are worrisome. It just says, let's learn how to see those and deal with those. And so it's understanding that life is both pain and pleasure. It's understanding that you're not avoiding negative feelings, but you're learning how to deal with them. And it's this idea of psychological flexibility. Oh, and I'm jumping right into food. Okay. Everyone always asks about food, which I think is essential. We do this. We eat multiple times a day, so I thought I'd put a few slides into this. We've included some of this into our tips, our weekly tips, include food information from experts. And with food, I think we're learning more and more that it's really this microbiome shifting into what's healthy for our bodies is preserving a healthy microbiome. And so it's moving away from unhealthy Western diet type of items like processed, packaged foods, lots of red meat, to a style of a Mediterranean diet. And indeed, that's the diet that would be suggested for mental health, and I think will gain much, much more evidence over the coming years. And those of you, probably many of you are familiar with the Mediterranean diet, essentially lots of whole grains, breads and pastas at the bottom, lots of fruits and vegetables, and minimizing at the top all the goodies like the sweets and baked goods, and taking them, but just taking them in smaller, more regulated amounts. I think what's also key about the Mediterranean diet is to point out that it comes along with a sense of community and eating together, and that happiness and that, that comes from not just eating on the go really quickly, but bringing people together to eat. And so that's part of the Mediterranean diet as well that we sometimes forget about when we just think about the food. There is a special dietary recommendations in individuals who have cirrhosis. So if this is you, then you can get a ton more information on a website that we've developed called cirrhosiscare.ca. And this is just a couple of pictures from a recent review that we've published looking at things like energy intake, protein, carbs, other nutritional considerations for cirrhosis. But there's a lot of videos and other information on cirrhosis care. One of the key things we point out is protein intake and making sure that you get enough protein, not only get enough protein, but you distribute it throughout the day so you can optimize the amount of protein that's going towards muscle building. So we're talking about 20 to 30 grams of protein a meal. We're talking about taking in, before you sleep, a late evening snack that contains protein, because that's the longest period of time that your body is going without any kind of energy, and that's important, especially in cirrhosis when our livers don't have that much ability to store glucose or energy anymore. And then it goes into the muscle to kind of break down muscle. So these are considerations for nutrition in cirrhosis. And then Dr. Carey, so I've added in this slide because you pointed it out yesterday, is coffee consumption. Oh, you've got your coffee cups there. Yeah, we do have some data, and there's not big randomized controlled trials, but there certainly is a theoretical basis and animal data for this, as well as cross-sectional data looking at big groups of people who are coffee consumers or not. And as she pointed out yesterday, there is evidence, as shown in this systematic review, for reductions in scar tissue in the liver, and also, as she pointed out, reductions in liver cancer. Again, I would say this is a weaker association than something like exercise and overall healthy diet, things that you can do, but it doesn't hurt. If you're a coffee consumer, then about that 3 cups a day. The problem comes when we add that 3 cups a day with a lot of sugar and a lot of other unhealthy things that go in there. So it's black coffee that we're talking about here, not caramel macchiatos. Okay, so I'm going to flip it over to Emily, who's just going to talk to you about our research journey.
Thank you. All right, thank you, Dr. Tandon. So I'm going to walk you through number 4, 5, and 6 on this lovely roadmap. So it started off when we developed this Peace Power Pack program, which is an online mind-body wellness program. So we had the mindful movement pieces that Dr. Tandon mentioned with yoga, chair exercise, and Tai Chi. We had breathing practices and meditation, and then those psychology components as well. And then we also added tips from PBC physicians every week, and also a weekly check-in. So this was like a 10-minute touch point with someone on our team just to see how the week's going for you, get your feedback, and also talk through any goal setting if that was of interest. And because this type of program had never been done in PBC before, we needed to do a pilot study, which is just a really small scale research study to see if this is acceptable for people with PBC. Do you like it? Is it feasible to recruit and do this online program? And also, what sort of outcomes can we begin to measure with this sort of study? And so we had 32 people, so it was very small. We had no Americans, so we just had Alberta and BC representation. All of our participants were female with an average age of 58 years old and 8.5 years since they'd been diagnosed with PBC. And overall, we found that people really enjoyed this programming, so it was acceptable for them. It was feasible to recruit these 32 people within our time frame. And then we saw that there was potential impacts on mental health symptoms and fatigue. And while this study wasn't a randomized controlled trial, which is kind of the best way to answer any sort of research question, we needed to add a control group to really see what sort of comparison we could make here. And then participants highlighted several areas that we can improve within the program itself, as well as the online website that they use to access the content. So then that led us to the Peace Power Pack randomized control trial. And so with this study, we enhanced the program. So we added some gamified elements you can see here. So we gave people points for things they watched in the program. They also unlocked badges at different levels. And we were really interested in if this program can actually impact mental health symptoms. So we asked and used surveys assessing anxiety and depression and fatigue and also quality of life. And so we had way more people this time. So we had 87 people from all over the world. So predominantly Canada and the US, but we also had a few from the Netherlands and Australia and 1 person from Africa as well. And the majority were still female with an average age of 60 years and 9.6 years since they'd been diagnosed with PBC. And this kind of highlights our big findings, but what we did this time was we randomized people to receive the Peace Power Pack program with that weekly phone check-in, or they received standard of care treatment, so they didn't have the program for 12 weeks. And then we looked at their surveys that asked about mental health symptoms and quality of life, and we saw that anxiety and depression reduced compared to those who didn't have the program, and also their quality of life improved when compared to those who didn't. And then we were interested if there was sort of a dose response. So if people who did the program a certain amount of time, did they have a greater impact? And what we found was that those who did the program greater than 3 times a week, so about 90 minutes across the week, they had a greater impact on their mental health symptoms, so anxiety and depression, as well as fatigue, which didn't show significance when we didn't look at those subgroup. And then we also did interviews with people just to see what sort of impacts the program had for them that the surveys maybe didn't capture. And people talked about all these components that helped them not only with their PBC, but in their daily lives. So breathwork was something that really helped people through stressful situations. Meditation was something someone recognized as being helpful at work. And then pacing, really valuable for that fatigue and managing their energy. So then we became really interested in these mind-body interventions that are delivered online and how can they impact not only PBC but other chronic conditions. So this is a recent systematic review we did. So we looked at all of the literature that's been done, that's been looking at mind-body internet interventions, specifically that measured anxiety and depression symptoms across a range of chronic conditions. And we had over 10,000 studies, but we narrowed them down to 56 that really met our criteria, which had over 7,600 people with chronic conditions. And what we found was that those who had access to this mind-body intervention had a significant reduction in their anxiety and in their depression symptoms. So for depression, it was a reduction of about 0.33, and anxiety about 0.26. And these are actually, these seem small, but these are actually remarkably similar to the drugs that are used to treat anxiety and depression. And then that leads us to the Empower program. So we took all the feedback from those previous studies, we made enhancements to the program and the content itself, and then we were also really interested in how does this work not only in PBC, but in other chronic conditions. So we had a couple questions going into this. So we wanted to know if this intervention can work across chronic conditions, and will it impact anxiety and depression symptoms in the same way? And then we also wanted to know about that personnel support and what level was really needed to have the most benefit. So Empower is actually a 3-armed randomized control trial. So where that previous study was 2 arms, this one is actually 3. So what that means is if you choose to join, we flip a 3-sided coin, and you're randomized to one of 3 groups for the duration of the study. So you could go in our control group, which means you'll wait 12 weeks and then have access to the program. And then you could go into 2 intervention groups, one of which gets the program, and then another that gets the program plus that weekly check-in. So we're interested if that extra level of support with the check-in is really necessary to have the most success with the program. And for people coming into this study, we recommend around 90 minutes per week based on that previous data that showed that more than 3 or more days per week had a greater impact on fatigue and quality of life, and that's less than 15 minutes a day. And then there are some surveys before and after the program that people do have to answer. So for those that are interested, we have enrolled those 662 people to the Empower program. The majority of our group is still PBC, so a quarter of everyone in the study lives with PBC, so 166 people. And we're still actively enrolling. And looking at the PBC-specific demographics, 35% have been diagnosed within the last 2 years, so we're getting some newer diagnoses. And about a quarter live with cirrhosis, and most people are on URSO. And then for the sex breakdown for PBC, obviously predominantly female, but we do have a few males in there as well. And as you can see, we're across the world, so we've recruited people from Canada and the US, as well as the Netherlands, Australia, and then a few other European and Asian countries as well. And as you can see, we have a lot of people. It's not only people in urban places that could benefit, but a lot of people who live rurally or remotely have joined the program who may not have access to this content that's not delivered online. And we thought you may not want to just hear from us, but also from other participants who've done the program. So we've done over 100 interviews with people, and this is just a subset of what they've had to say about their experience in the Empower program. So we'll just go ahead and play this so you can hear from them.
The breath work gives me the proper way to breathe easily in times of when you are, say, stressed, or when you are like resting. If you want to rest like fully, it helps you a lot. And like I said before, like during the time that I can hardly breathe, I think about those things, and it helps me a lot.
Definitely, it improved my mental states, not only for the physical activity or for being to do it together with my wife, but also because like I said, the breathing and the meditation, I think, did a change in my emotional state.
And the breath work is amazing. Like, I had never considered it before. Now I can use deep breathing or belly breaths to put myself to sleep.
And my point of view, those little videos regards of the psychology, they are good because they are short. They have I call them very nutritious, and because they are very brief, but let's say very substantious, they get an impact. You know, that's true. Click.
And I'm pretty sure, like this program will help a lot of but the core of the program is the breath work and the meditation. That's 100%.
Now, I don't know why necessarily, but it changed my life, and it's got to be because it made me stronger. It made me healthier. It made me happier.
For everybody, because of the way the intensity of the program is. It's for people who have like low mobility to a higher mobility, to the highest mobility.
I can't say enough about it. I so appreciate it because I am like night and day. It's great.
All right, so maybe you're wondering how you can join this amazing program. So we are in our final 2 months of recruitment, and we have several methods. So there's a QR code here you can scan. It'll direct you to our consent forms and our surveys, our websites listed there, our email, and then I also have a lot of little cards with me. So if you're interested, you can take one of those cards and scan it at home later. And if you have anyone else in your family, we have not just PBC, but we have 10 other disease-specific programs and then a general program too. So if there's someone in your life you think could benefit, then absolutely send them our way. And then I'll hand it over to Dr. Tandon just for the final points.
Thanks, Emily. Okay, so take-home points from today: chronic stress, anxiety, and depression have significant health impacts. We hope we've been able to show that. And we've also, most importantly, hope we've been able to show that there's stuff you can do to empower your journey towards living a happier, healthier life with PBC. And empower for us is in our lab the beginning, I think. We are looking forward to looking a little bit more at how much of a dose individuals need, what components work best, what predicts response. We've done a general program, but we're really interested in looking at specific fatigue, sleep, and even caregiver programs. So we have put in an application for caregiver program as well. Strategies to enhance adherence, getting a better understanding of the mechanisms. So our next studies will hopefully include these kinds of brain scans and additional blood work, et cetera, that can help to get a little deeper into that. And then figure out how we can get these kinds of things out to more people with our patients right by our side, helping to guide us on how to do that best. So we do hope that we've helped to share some of that knowledge with you, and absolutely reach out to us at any time. We're going to be here for the rest of the day to chat, and happy to take questions, obviously, as well. Thank you, everyone.
Cool. Thank you both for presenting.
Do you want us to stay for questions, or is
Yeah, we have some time.
Okay.
So all good. But first off, great presentation, a lot of good information. I think it follows along much of what we spoke at the last conference, 2022. I don't think you were able to attend, but
Yeah.
you know, Leslie had presented a lot of around meditation, mindfulness, exercise, diet, as
Awesome.
well as a WSLD. They had something in the patient portion of WSLD
Yeah.
around this, so that's great as well.
Yeah.
Now, are you looking for, obviously you're looking for people to scan this, sign up, and join the Empower program, correct?
Yes, guys, we need ideally to get to about 800 patients. Yeah.
And you're at what now? How many?
650,
Okay.
662.
Okay. So this is something they can scan here as well. They could take a picture and share it with their friends. You know.
Absolutely. So it'll help us out to get there faster.
Yep.
Yeah.
And you're doing PBC, but also others. So is that 650 going to be?
The total of everybody. Yeah.
Okay. So all conditions as well.
Yeah.
Great. Good to know. Good to know. And I think, Leslie, did you have a question as well for?
Yes. Can you recommend tools to help with focus and staying on task during the day?
Yeah, I think what we talked about. Like it's really, again, it's strengthening the brain activity in the areas that we want to strengthen it, and reducing stress in general, I think, allow us to focus and be more clear. So there's obviously many, many things that you can do, but some of the strategies that we've pointed out, the taking time for relaxation, allowing breath work and meditation to kind of work their magic, that really has helped with clarity and focus for many individuals. Clearing your task list, prioritizing what's important to you, figuring out what your values are, all of those things can also help to bring focus to the things that you really want to obviously bring attention to during your day.
Mm-hmm. I wonder, yeah, let's bring a microphone over here, down here as well. I was wondering as well, like a lot of us get kind of in the social media rabbit hole.
Oh, yeah?
And go down to videos. We may have heard one during the.
Yeah.
But as far as, breaking that cycle, do you have any recommendations as far as breaking loose of technology, as well as using technology for like wearables?
Yeah.
And that enhancing the program? Just wondered on that. We got it.
No, it's a really good question. I mean, I can speak to personally what I've done, but I think we have to be careful. We can get into a situation of information overload, and a lot of what's out there is negative. A lot of what's out there, if you listen to the news and, start your day with the newspaper, which many of us do, we just have to be careful about how much we're feeding our brain, because we don't know exactly all of the things that are happening in our physiology inside from what we're taking in. It can't be positive watching all of the negativity out there. So just try and remember that, and maybe switch to obviously being aware of what's going on in the world, but at the same time bringing in some more positive things, listening to podcasts that you really like, listening to inspirational speakers that you really like, just making sure you balance that.
Good point. And are you using some of the wearable aspects too? Like I know my watch sometimes will say stand up.
Absolutely.
Or breathe, those kind of things, right?
Yeah.
Is that part of the program, or is that just something you may encourage people to do during?
Yeah, that's coming up with the next program. We're going to have wearables in there, so looking at the heart rate variability and other aspects.
Okay, cool. And I think we have a question here.
It's not a question. I've taken the Empower program, and in response to the person that was asking about focus and concentration, it's definitely shifted my focus and my concentration, and I branched off from the Empower program to my own yoga, meditation, and breathwork practice. And I relate best to the woman in the video in the fact that it's completely changed my life.
Nice.
Thank you.
So you're helping others now as well, kind of manage their wellness?
Well, if I bring my best self to everyone that I relate to,
Gotcha.
it pays off.
Nice. Yeah, I was wondering, like, what about sharing this with family, friends, and all of that? Do you encourage participants to say, so that you're not sitting in the middle of the room by yourself and your spouse walks through and says, what the? Are you encouraging family and others that are living with the members to participate as well?
Yeah, we have a few participants, a couple people in the video, their partners will do the program with them and learn from the psychology and do the yoga and all those components with them. And we have so many programs and a general program, so if you have a caregiver, family, friend, partner who would benefit from a program like this, there's likely something that would fit for them. So,
Cool.
Yeah.
Cool. And will you have then, I guess, this published right after you're done with this study and share? So it'll be something that'll be shared with others after this, right?
Yes, it'll be my PhD dissertation. So.
Nice.
Yes.
Good work. Good work. And another question, Leslie?
Yes. Best time of day to practice? Morning, start off the day, midday, afternoon, evening?
Yeah, we get that question a lot. It's really what works for you. The benefit of this program is it's entirely online. There's sleep meditations. There's stuff for supercharging your day. So really, whenever you feel you could benefit from a little push, you can log in and access a component of the program.
Yeah, we do polls during the program. Emily is the poll poster. And so we asked that question, when do you do the program? And it was interesting. I mean, people had various different responses. I think the most common that we've seen is morning, that people will do it. But some people do morning and evening. Some people will do it in the afternoon. So whatever works, just do it.
Nice. We had a workshop with care partners yesterday as well.
Yeah.
And have you guys looked at kind of taking that perspective of care partners that have to deal with a lot of that stress as well, and them having their own program?
That's exactly what yes. And so what we do in the lab is really driven by the voices of people coming to us and saying in our clinics what they need. And that was one of the loudest voices saying that our gap is that we don't have something for care partners and we need something. So we've written a grant that we've both worked on. And we're really hoping that eventually we'll bring that to fruition as well.
Awesome, awesome. And I think, is it Sujal has a question?
I do. So the Empower program seems fantastic for those with chronic conditions to want to get a start. I feel even personally myself that sometimes just the inertia to start is the most challenging. We sit in this type of presentation and say, amazing, I want to do this. And then we leave and we don't start. Do you have any tips for folks on just how to start and get to some inertia to continue?
Yeah. Do you want to start?
I think that's probably the biggest battle that we face. So people will start their surveys and may not continue on, but we do an orientation with everyone before they commit to the program, so you can totally understand, what am I actually committing to here? What's the timeline? So we hope that that connection and that information helps foster that push. And then to the program, we've added some gamified elements. So you get points, you get badges, you can give other people likes and kudos. We've added some gift card raffles. So those are some other things that we're trying to help push people forward. And then Sean has done some group sessions for us with the PBC community, and that community connection seems really important to get people through.
Yeah, and I think it's just realizing, kind of, again, prioritizing values and maybe hoping that understanding the stress behind all of this, and understanding the science behind all of this, and understanding that there is an accumulation of wear and tear on the body that happens with chronic stress. Maybe we don't actually realize how harmful it can be. Helps us to prioritize some of these practices. Literally 5 minutes a day. Sometimes studies have shown a significant benefit. So it is, if you look at it in the big context of what a week is and how many minutes there are in that, it's a drop in the ocean, right? So it is just a matter of taking the time and deciding that you want to do things for yourself. I find many times we prioritize other people or prioritize how easy is it to go down the rabbit hole of social media, and oh my God, it's been an hour and I've been looking at my Twitter feed, right? So can you do something else instead of using your time for that? And it's really just setting that intention and getting in there and doing it. There's just Nike, just do it. That's it. Yeah.
Nice. So we're scheduling some time, like at lunch, for a quick
Put it in
meditation,
your calendar.
breathing. No, I mean today, because we had Leslie doing it yesterday. Some stretching and some breathing
Great.
outside or
We
in
can.
air conditioning if you want.
I've got a dress
So
on, but we can
maybe
still
around
do that.
lunchtime, have people go out there before they go to lunch.
Sure,
Is that good?
we can.